Every single day, people push themselves through intense AB workouts, cut calories, avoid carbs, and still look in the mirror wondering why their stomach refuses to flatten. It's frustrating. You follow the rules, you stay disciplined, and yet something doesn't change. That stubborn outward pressure remains, almost like your body is working against you. Most people immediately assume the same thing: it must be fat. That's the easiest explanation. Eat less, move more, and the belly should shrink. But here's the uncomfortable truth. In many cases, what you're seeing is not just about fat at all. There's something else happening inside your body that almost no one talks about. This misunderstanding leads people into a cycle of constant effort with minimal results. More crunches, stricter diets, more frustration. The logic seems correct, but the outcome doesn't match. That's usually a sign that the problem is being approached from the wrong angle. Inside your abdomen, there are layers between your skin and your internal organs. Yes, fat is one of them. But even in individuals with higher body fat, there's a limit to how much that layer alone can push outward. When the stomach protrusion exceeds that, something deeper is involved. That something is not visible from the outside, which is why it's often ignored, but it plays a major role in how your body looks and feels. Once you understand this, your entire perspective on belly fat begins to change, because the real issue may not be what you're adding to your body, it may be what's shifting inside it. To understand what's really happening, you need to look beyond the surface. Inside your abdomen, your digestive organs are held in place by supportive structures. These structures keep everything positioned properly, allowing your body to function efficiently. But over time, these supports can weaken. When that happens, the organs they hold begin to shift downward. This is a gradual process, and most people don't notice it happening. They only see the result: a belly that pushes outward more than expected. When internal structures move downward, they don't disappear. They occupy space, and since there is limited room internally, that pressure has to go somewhere. The easiest direction is forward against your abdominal wall. This creates a constant outward force. No matter how much you try to flatten your stomach from the outside, the internal pressure keeps pushing back. That's why traditional approaches often fail to deliver lasting results. This is not about lack of effort or discipline. It's about understanding the mechanics of your body when internal positioning changes, external appearance follows. Once you recognize that this is a structural issue, not just a weight issue, the approach changes completely. You stop fighting symptoms and start addressing the cause. At first glance, this might seem like just a cosmetic issue, but the reality is much deeper. When internal structures shift downward, they don't just affect how your stomach looks, they influence multiple systems in your body. Pressure begins to build in the lower regions. This can affect circulation, making it harder for blood to move efficiently. Over time, this may contribute to heaviness in the legs, visible veins, and general discomfort. The digestive system is also affected. When internal positioning is altered, movement through the digestive tract can slow down. This leads to issues like bloating, irregular bowel movements, and persistent discomfort after eating. For some individuals, there can also be pressure on nearby organs. This may create sensations of urgency or discomfort that seem unrelated at first, but actually connect back to the same underlying cause. These effects don't appear suddenly. They build gradually, which is why they're often dismissed as normal or age-related. But they are not random, they are mechanical outcomes of internal changes. Understanding this connection is powerful, because once you address the root issue, multiple symptoms can improve at the same time, not just the appearance of your stomach. Now comes the important shift. If the problem is internal positioning, then the solution must also address internal mechanics. This is where most people change direction and start seeing real results. Instead of focusing only on burning calories or tightening muscles from the outside, the goal becomes restoring balance from within. This means supporting the structures that hold everything in place and improving how your body distributes internal pressure. The body responds well to mechanical correction when structures are guided back toward their natural position. The outward pressure begins to reduce. Over time, the abdominal area starts to feel tighter, not because of extreme effort, but because the internal force has decreased. This approach does not require extreme dieting or exhausting routines. It requires consistency and proper technique. Small, targeted actions performed regularly can create significant changes over time. It's important to understand that this is not an instant transformation. Your body adapts gradually, but when the direction is correct, progress becomes visible and sustainable. This is where many people finally start seeing results, not because they tried harder, but because they started working smarter with their body instead of against it. At this point, you need to understand one powerful idea. This is not a battle against fat, it's a battle against gravity. Every single day, whether you realize it or not, gravity is pulling your internal organs downward, and over time, this constant force begins to change how your body is structured internally. Your body is designed to resist this force. It uses connective tissues, ligaments, and muscle support to hold everything in place. But these structures are not permanent. They weaken with time, inactivity, and certain lifestyle habits. When support weakens, internal organs begin to shift. This shift is not dramatic or sudden, it happens slowly. But the effect is cumulative. As structures drop, pressure builds, and your body adapts to this new position. That adaptation is what you see externally. Your stomach appears larger, even if your weight hasn't changed significantly. This creates confusion because the visual change doesn't match your efforts. Once you recognize that gravity is a constant factor, you begin to approach the problem differently. Instead of trying to burn something away, you focus on restoring support and alignment. This shift in thinking is the foundation of real change. Because when support improves, your body begins to correct itself naturally. One of the biggest misconceptions is that diet alone can fix this issue. While nutrition is important, it does not directly address structural positioning. You can lose weight, reduce fat, and still experience the same outward pressure. This is why many people feel stuck. They follow strict diets, see improvements in other areas, but their abdominal shape doesn't change as expected. It's not because they're doing something wrong, it's because they're targeting the wrong factor. Fat loss reduces volume under the skin, but it doesn't reposition internal structures. If something is pushing outward from inside, reducing external layers won't remove that force. This leads to frustration and often to more extreme approaches. People cut calories further, increase exercise intensity, and push themselves harder. But without addressing the internal mechanics, results remain limited. Understanding this allows you to stop overcompensating. You don't need to punish your body, you need to support it correctly. When structure and function are restored together, results become far more noticeable and sustainable. So what actually works? The answer lies in mechanical correction. If something has shifted, it needs to be guided back. Your body responds to physical input, and when applied correctly, this input can restore balance. This doesn't require extreme force or complicated techniques. It requires precision. Small, controlled actions can influence internal positioning. When done consistently, the goal is to create conditions where your body can return to its natural alignment. Once that happens, pressure reduces and your body no longer needs to compensate. This is why certain targeted exercises can create visible changes even without major lifestyle adjustments. They work directly on the root cause instead of the symptoms. Consistency is the key factor here. A single session may create a temporary effect, but repeated practice trains your body to maintain the corrected position. Over time, this becomes your new normal, and that's when results become stable instead of temporary. Now let's break down the first step of the technique. This part focuses on breathing and preparation, and it is more important than most people realize. Without proper execution here, the rest of the process becomes less effective. Start by standing or sitting comfortably. Take a deep breath, then slowly exhale until your lungs feel completely empty. This is not a casual breath, it should be controlled and complete. As you exhale, allow your chest to contract naturally. Don't rush this step. The goal is to remove as much air as possible so your body can enter a different pressure state. Once you reach the end of your exhale, pause. This moment is important because it creates the conditions needed for the next step. Your body is now in a position where internal pressure can be adjusted. Most people don't go far enough here. They stop halfway, which reduces the effectiveness of the exercise. Full participation is what makes the difference. This step sets the foundation. Without it, the rest of the movement loses its impact. After completing the exhale, the next step is to engage your abdomen. This is where the internal shift begins. While holding your breath, gently draw your stomach inward. The goal is not to tense aggressively, but to create a controlled inward movement. Imagine pulling your abdomen toward your spine, creating space inside your body. This action reduces internal pressure and creates a lifting effect. It allows structures to shift slightly upward instead of pressing downward. You may feel a strong sensation during this step. That's normal. It means your body is responding to a new stimulus. Stay relaxed and focused. Hold this position briefly, then prepare for the next phase. The combination of breath control and muscle engagement is what creates the desired effect. With practice, this step becomes easier and more effective. The final step adds a physical component. While maintaining the previous position, use your hands to apply gentle upward pressure on your lower abdomen. Start near the base of your abdomen and move upward slowly. This should be a controlled, deliberate motion, not rushed or forceful. This action supports the internal shift created by the previous steps. It guides your body toward a more natural alignment. Once you complete the movement, release slowly and allow your body to return to a relaxed state, then take a normal breath. This completes one cycle. Even a few repetitions can create noticeable changes when done correctly. The key is consistency. Repeating this daily trains your body to maintain improved positioning over time. Most people don't see results because of small mistakes. These mistakes reduce effectiveness without being obvious. Fixing them can dramatically improve outcomes. One common issue is incomplete breathing. If you don't fully exhale, the internal pressure change is limited. This weakens the entire process. Another mistake is rushing. Quick movements reduce control and prevent your body from adapting properly. Slow, deliberate action is far more effective. Using too much force is also a problem. This is not about strength, it's about precision. Gentle, consistent pressure works better than aggressive effort. Skipping consistency is another major factor. Doing the exercise occasionally won't create lasting change. Daily repetition is what builds results. Avoiding these mistakes ensures that your effort translates into visible improvement. Results don't happen overnight, but they do happen. In the first week, you may notice subtle changes, less pressure, slight improvement in comfort. These are early signs of progress. By the second or third week, changes become more visible. Your abdomen may feel tighter, and the outward pressure begins to reduce. This is where motivation increases. Around the third or fourth week, results become noticeable externally. Your body starts to reflect the internal changes you've been creating. It's important to stay consistent during this phase. This is when your body is adapting, and consistency ensures that progress continues. Everyone's timeline is slightly different, but the pattern remains the same: gradual improvement followed by visible change. Patience is key. The process works, but it requires time. For lasting results, this needs to become part of your routine. Your body responds to repeated patterns, and long-term consistency creates stability. Over time, the structures supporting your body become stronger. This allows your body to maintain alignment with less effort. What starts as a corrective exercise becomes a maintenance habit. The effort decreases, but the benefits remain. This is how sustainable change happens, not through short-term effort, but through consistent practice. Once your body adapts, maintaining results becomes much easier, and that's when you truly move from effort to control. Age plays a role in how quickly changes occur. As we get older, connective tissues lose strength and elasticity. This makes internal support weaker over time. That doesn't mean change is impossible. It simply means consistency becomes more important. The body still responds, it just takes more time. Understanding this helps set realistic expectations. Progress may be slower, but it is still achievable. The earlier you start, the easier it is to maintain balance, but improvement is possible. At any stage, the key is to work with your body, not against it, and consistency always beats intensity. At the end of the day, your body is not broken, it's adapting. The changes you see are responses to internal conditions, not failures. And when those conditions improve, your body follows. You don't need extreme diets or endless workouts. You need understanding, consistency, and the right approach. When you address the root cause, everything begins to align, not instantly, but steadily and reliably. This is not about chasing quick results. It's about creating real, lasting change. Start today, keep it simple, stay consistent, and let your body do what it was designed to do. Return to balance naturally.